Getting a lung cancer diagnosis can be scary. It can feel confusing and life-changing, and it is. However, it does not have to be. With the proper information and tools, you can make sense of the darkness you find yourself in and work to develop a treatment plan with your doctor that allows you to fight this horrible disease. This is the goal of this presentation, to allow you to see your treatment options and understand what will work best for you, so that you are able to advocate for yourself, but also make sense of the situation you find yourself in. At this point, you're probably wondering what exactly is lung cancer. It is the rapid expansion of cells in the lungs that can cause tumor growth. Cell growth normally happens in a set cycle, and the body's able to process what is going on. However, when you have a cancer diagnosis, this process gets messed up, and the cell growth happens rapidly, and it causes issues in the cellular division and replication process. There's two types of lung cancer: the small cell lung cancer and non-small cell lung cancer. Small cell lung cancer happens with the rapid cell growth, obviously, and it can spread through all parts of your body. Non-small cell lung cancer also happens in the cellular replication process. However, it forms massive tumors that are a little bit easier to remove. Overall, both types of cancer can be spread via the blood and lymphatic system. Okay, so now that you know what exactly you have, what are your treatment options? First off, you can have surgery. This tends to be the most common types of treatment, but is only ideal if you have the small cell lung cancer, as it tends to be localized to your lungs. Next, you can have chemotherapy. This is the most common type of cancer treatment and is probably the one you've heard the most about. This is ideal for both types of lung cancer and can tend to be used like adjacently to any other types of treatment. Radiation therapy is also one of the more common types of treatment that you tend to hear about for all types of cancer. This also tends to be used adjacently. And then you have immunotherapy. This tends to be used for small cell lung cancer in particular, as it's ideal for tracking down the cancer cells that have spread throughout your entire body. So what exactly does surgery entail? Okay. There's 4 types of surgery that you can get for your lung cancer. This tends to be the lobectomy, pneumoectomy, wedge resection, or segmental resection. The lobectomy is where the tumor is located on a specific part of your lobe, and you're able to just remove that entire lobe, and you're still able to breathe. The other option is a pneumectomy. This is where the cancer is spread throughout the entire lobe. However, it hasn't gone to the other one. So you're able to just take out the entire lobe of your lung, and again, you're still able to breathe. The other one is the wedge resection. This tends to be the most concentrated. So if the tumor is found only on one specific part of the lung, then they can just remove that specific part. Same with the segmental resection. This is ideal for cancer that is only located in the lung, and you also may have to have treatment that is adjacent to this type of. So if you're getting surgery, you tend to need to have an adjacent therapy with it as well. And then you also have no major side effects. So if your doctor recommends surgery, then this tends to be one of the better options. Chemotherapy, again, the most common type of treatment for small cell lung cancer. This is because it can break down the cells that are found in your body. It tracks them down, it uses the drugs to target those cancer cells, it breaks them down, it also boosts your immune system. However, it has some serious side effects, which you guys have probably heard about in the news. This includes vomiting, hair loss, weight loss, bruising, and vomiting. It also tends to be used adjacently. Radiation, again, extremely common. It uses high energy X-rays to target specific cancer sites. This is ideal if you have tumors that are really hard to reach, such as maybe it has spread to your brain or other parts of your body. Not quite ideal for just in the lungs. It tends to break down the genetic DNA that is found in the tumors to prevent them from reproducing, and it also helps to just break down the tumor in general. It's ideal for shrinking the tumor size. It's a great primary treatment. It also stops the growth of any new cells by, again, preventing that cellular reproduction, and it tends to be used adjacently with chemotherapy, again, making those 2 the most common types of treatment. Last but not least, we got immunotherapy. This is a drug that boosts and supports the immune system. There's 2 different types. You have the synthetic version of the immune system and immune system stimulants. Synthetic version of the immune system basically means that it gets in there and it supports the immune system, but then it also kind of replicates what your typical immune system cells do and helps attack the cancer. And then you have immune system stimulants, and this basically means that it allows your immune system to grow rapidly and really figure out what cells that they need to target It's recommended if you have high levels of the PDL1 protein or gene mutations. This is something your doctor is going to tell you when they mention it. The nice thing about immunotherapy is that it tends to last longer than chemotherapy in your body because it directly replicates what your immune system does. This also has some side effects such as diarrhea, skin rashes, elevation of liver enzymes, shortness of breath, high thyroid levels. However, it works really well for destroying the cancer. So, which option is right for you? Immunotherapy, again, is ideal if it has spread beyond your lungs, and it's ideal to support your immune system. This tends to be one that is going to be recommended by our doctor, but it's useful to know what it does. Chemotherapy, again, the side effects tend to sway people off. However, it's ideal as conjunction with other types of treatment. Radiation is ideal for localized tumors, and there's limited side effects with radiation. So again, if this is something your doctor recommends, it's definitely something to consider. And then surgery, if the cancer is located in just your lungs, this is pretty ideal. And this is going to be your best case scenario treatment option. Just do understand that you're going to have adjacent treatment if you choose this plan, if you choose this path. But at the end of the day, it's important just to listen to what your doctor recommends and choose a treatment that is going to make you feel the most confident and will work with you in your lifestyle. So, here are my citations, and thank you.